Good day everyone, my name is Francis Mercado from BSN2B, and so today I will be demonstrating the immediate care of the newborn. So the newborn's immediate needs are the following. First are to breathe normally, second to be warm, third is to be protected, and fourth is to be fed. So going to assess the progress of labor of the mother, and we will also assess the infant once the baby is out, the color of the baby and its airway, breathing, and circulation. And we are also going to assess the vital signs of the mother and the uterine contraction. And lastly, we will be able to assess the feeding cues of the infants. So by the end of this procedure, we will be able to assess the infants if she will be able to adapt in the outside world once the baby is out. And we will also assess the mother complication and ensure that she is free from these complications. So good morning ma'am, my name is Francis Mercado and I will be your student nurse for today. So today ma'am, I'm going to assist you in your labor before, during, and after. So are you comfortable with your position ma'am, or do you want me to adjust you? Okay, you're comfortable. Do you want to take a break, eat, or go to the bathroom ma'am? Okay, you don't want to. Your current progress of labor ma'am, you are now in your uterine contraction is now at 7 cm, so it's not fully dilated. So I will be here ma'am, and I will going to assist you before and after or during your labor. Do you need anything ma'am? Do you want me to assist you with? Okay. So hello ma'am, are you okay with that position? Okay, so this position is the default position or the semi-upright position in the delivery room. So we need to keep the room temperature within 25 degrees Celsius. All windows are closed, and we need to ensure the woman's privacy, and we need also to remove all the jewelry and any accessories like earrings, necklace, and bracelets, and we also going to wash our hands thoroughly and observing the WHO 1, 2, 3, 4, 5 procedure. Next, we are going to prepare a clean newborn resuscitation area, check the equipment if they are clean, functional, and within reach. And next, we are going to arrange all the materials and supplies in a linear sequence. So we have here the cord clamp, the vitamin K, and the tuberculin syringe. Next is the CRIDS prophylaxis, the forceps, kidney basin, scissors and blade, and gloves. And after preparing all the necessary equipments, we are now going to wash hand and put 2 gloves aseptically. At the time of delivery, encourage the woman to push as desired. So ma'am, I need you to push. Okay ma'am, 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. And while the baby is not already out, we are going to place a clean dry linen over the mother's abdomen or the shoulder. This is in a preparation for the drying of the baby. Okay ma'am, I need you to push. 1, 2, 3, push. And now I'm going to apply a perineal support. Okay, perineal support, and do control the delivery over the head. Okay, ma'am? Okay? So now, okay. Baby boy out, 12:30 a.m. So, I'm going to carefully put the baby on the mother's abdomen in a prone position. And now, I'm going to dry the newborn thoroughly. Okay? And stimulate the baby to breathe normally by minimize heat loss. Duration to 30 seconds, and during the first 30 seconds of the drying of the stimulation. Okay, so Do not over-suction unless mouth or nose are obstructed with secretion and other materials. And do not ventilate unless the baby is apneic and the baby is floppy. And do not rub off the vernix. And if the baby is not breathing, dry and stimulate after 30 seconds. And if the baby fails to breathe, suction, change gloves, and cut off the cord quickly and transfer to a firm, warm surface and start the newborn resuscitation. And next is the remove the wet cloth and check the breathing. Okay, now, so I'm going to remove the wet cloth. Okay. The breathing is normal. I don't see any abnormalities. After 1 to 3 minutes, position the newborn on the mother's abdomen and skin-to-skin contact. Okay. We're going now to position the baby on the mother's abdomen for the skin-skin contact. And I'm going to cover the back of the baby with a dry blanket. And if this is not possible, place the newborn in a warm and safe place close to the mother. And after that, remove the first set of gloves, and we are now going to clamp and cut out the cord. So I'm going to remove the first set of my gloves. And now we are going to clamp the cord of the baby. But before that, we are going to feel the palpation. Okay. After the palpation stop, clamp up to 5 cm from the base. Okay. We're going to clamp from the base. After we put a clamp on the base, we are now put plastic clamp or tightly around the cord at around 2 cm from the baby's abdomen. Okay. Okay. We already put the clamp. And next, we are going to cut the cord between the thighs with a sterile instrument. Okay, so now we are going to cut the cord of the baby. Okay, so now I'm going to put this inside the kidney basin. Okay, together with the scissor. And now, observe for, after we cut the cord of the baby, we are going now to observe for the oozing blood, and if blood oozes, place a second tie between the skin and first tie. And do not apply any substance to stump, and do not bind or bandage stump, and leave the stump uncovered. And after the first complete breastfeeding, we are now going to proceed for the eye care. We are now going to wipe the eye of the infant. We're now going to wipe the eye of the infant from inner to outer canthus and to the other side, inner to outer canthus. And next, we are now going to apply a antimicrobial after within hour of birth. So I'm going to put this. Okay. Okay. Put an ointment in the inner and outer contour of the baby's eye. This is to protect the baby from any transmittable disease, just like gonorrhea. After applying the ointment from inner to outer canthus of both eyes, instill the lower conjunctival sac with 1 drop of tetracycline on both eyes. And next, for the injections, we are now going to administer a 0.1 cc of vitamin K at the upper outer quadrant or the vastus lateralis of the thigh. I'm going to clean the area. I'm going to administer the vitamin K. Okay. After administering the vitamin K, next is to administer the BCG vaccine IM. Okay. After administering the BCG, next to administer is the hepatitis B vaccine. Okay. And after administering all the vaccines, we are now going to take the anthropometric measurements of the baby. Starting from the length of the baby. Okay. We're now going to start from the length. Okay. And next, we're going to take the head circumference. Okay. And after that, next is to take the chest circumference of the baby. Okay. And lastly, take the abdominal circumference of the baby. Okay. And after taking all the anthropometric measurement, we are now going to weight of the newborn. So we need a weighing scale. So let's assume that this is a weighing scale. I'm going to weigh first the cloth of the baby. Okay, so let's assume that we already taken the weight of the baby. And next, we are going to weigh the baby. Okay. After taking the weight of the baby, we are now going to subtract the weight of the cloth from the total weight of the newborn. And next, we are going to get the footprints and the stamp it on the charts. And next is to assess the baby for any signs of illness and if chest is drawing or grunting. So I don't see any abnormalities. The baby's breathing is normal. And next is if baby is doing well, keep mother and baby in the skin-to-skin contact. Okay, so now I'm going to place the baby on the mother's abdomen. Advise the mother to observe for feeding cues and cite an example of the feeding cues. So every baby is different at the rest period may take from a few minutes. Or the baby shows signs of wanting to breastfeed. Observe the newborn if shows feeding cues just like opening of the mouth, tonguing, licking, and rooting. Do not give sugar, water, or any formula, and do not give bottle of pacifier, and do not throw away the colostrum, and complete all the records.